So please, you have the word.
Benim sunumlarım Türkçe.
Thank you very much. I'm going to present in Turkish, so I'm sorry. I would like to apologize from our international guests. I would like to thank Nazan and all the organizing committee. I'm here to talk about delivery-related PTSD. Of course, we're talking about DSM-5. We're talking about re-experience and withdrawal, and there are certain numbing in the emotions and feelings, and we also have symptoms for overstimulation. When we look at response to stress and trauma, we know men are different from women. Women usually have stress in relation to their relations, and women are more prone or vulnerable towards depression and PTSD, and they are more prone to physical diseases. Of course, in women, pregnancy, delivery, and post-delivery period can be very traumatic, and it can affect the rest of their lives. So how do we define trauma or delivery-related trauma? Of course, it starts with labor. I don't know how we say it in Turkish, so I just say labor in Turkish as well. And of course, during labor and delivery, a serious injury occur or maybe death occur, and this could be a serious trauma for the woman. Of course, they have some, desperation and fright. And when you look at Sweden, for example, it's only 1.7, and in Nigeria this increases up to 5.9%. So it's around 2%. This is delivery-related PTSD incidents. For example, in Iran, the rate is 17.2%. Of course, the cultural differences change the result. That's what those researchers state. When we look at the definition of PTSD, sometimes some patients do not meet all the criteria of PTSD, but they experience certain symptoms of PTSD. So we know that in the United States of America, it's around 34%, and in the Netherlands, it's 21.4%. This is the incidence of PTSD related to delivery. And as you know, trauma goes down in time. So in the 6th week after delivery, we see that the prevalence is around 3 to 6%. In the 6th month, it goes down to 1.5%. When we look at the general population, we know that the PTSD, we don't know whether the PTSD is higher in the postnatal population compared to general population. Of course, PTSD is a very important social problem as well, because the mental problems of the mother is going to adversely affect the child, because it's going to disrupt the relation between the mother and the child. It's going to delay the psychological and physical development of the baby. So if it's not treated in the earlier phase, and of course it's going to be much more difficult to treat in the later phases. Kessler has certain recommendations regarding PTSD. We know he also states that the total cost is quite high, and the individual is going to suffer from this throughout life, because they're going to refrain from having a child, they're going to refrain from getting married, or even if they're married, this marriage life is going to be disrupted. They're going to lose their jobs, and of course they're going to be more needy in terms of social aid. So, an early intervention is going to bring down the total cost to the society. Let's take a look at the risk factors. High level of obstetric intervention is an important risk factor, and if the mother is not satisfied with the help or the support during delivery, this is an important risk factor. And the sense of weakness and desperation and preterm delivery, and a psychiatric illness or psychiatric disorder history is important, and anxiety during pregnancy plays an important role as well. How to induce the delivery, the suboptimal treatment of pain, and unnecessary invasive interventions, and certain urgent obstetric situations. And if the baby is put in the neonatal unit, and tachophobia is an important factor as well, or if it's the first pregnancy, being prone to anxiety, sexual trauma history, they will all play an important role. Preterm delivery is important. Let me go into the details here. This is delivery before the 37th week. And if the babies are delivered before the 28th week, then it's extreme preterm delivery. If it's between 28 to 32 weeks, it's very early delivery. And if it's between 32nd and 37 weeks, then it's preterm delivery. Of course, prematurity is important because it increases mortality among the infants, and it increases pediatric morbidity as well. In 2010, there were nearly 15 million preterm deliveries in the world. This is an assumption, and more than 1 million babies died due to causes directly related to preterm delivery. Of course, there are short-term and long-term consequences of prematurity. They can have retinopathy because of the preterm delivery. They can have respiratory stress. They can have injuries on their brains, and they have other neurological problems. And in long-term consequences, there are disruptions in motor and emotions, and they have problems and difficulties in learning. They have some neurocognitive disruptions, and they have some behavioral problems in the future. Of course, it's quite costly as well. When you include hospitalization, it's around 20 million Canadian dollars, and it causes a lot of emotional and physical problems. If women deliver preterm, then 67% of these women suffer from PTSD symptoms. And when you look at the control group, if the babies are delivered full term, then it's only 6%. So there's a significant difference in between. And we know that the trauma signs can continue even on the 6th and the 18th month. Preeclampsia is an important issue. It starts after the 20th week of the pregnancy, and it causes hypertension with edema and proteinuria. And the most important complication is death, and it's one of the most important causes of death during pregnancy. And in preeclamptic women, the PTSD rate is between 5 to 44%. Of course, PTSD has some disruptive consequences in the couple's lives. It causes disruptions in the relations between the mother and the child, as well as the mother and her spouse. And it also causes sexual problems. Forkadogweix et al. Looked at the PTSD rate in mothers with preterm deliveries. And in mothers who delivered preterm and who had PTSD symptoms, then they had more disruptions in their relationships with their infants. Okay, the mothers are very adversely affected. They suffer from depression and PTSD. What about the fathers? 12% of women suffer from postpartum depression. This rate is 7% for men. And women with postpartum depression, 24 to 50% of these women, spouses also suffer from depression. And one meta-analysis shows us that the rate is 10.5%. This is the postpartum depression rate among men. If the mother delivered on term and if the baby is healthy, still the fathers can suffer from PTSD symptoms. Okay, let's go on with the treatment because I'm running out of time. We don't have any specific medical treatment for postpartum PTSD. For other PTSD cases, whatever you're doing is going to be suitable for these women as well. We have some case studies in the literature, but there is a study, there's a trial in France. They published the protocol, but we don't have the treatment outcomes. So this is an 8-session PTSD treatment for women who are suffering from PTSD as a result of preterm delivery. Did I run out of time, by the way? Is my time up? All right, fine. Let me show you a couple of cases. The first case is a 35-year-old teacher. She came to us with PTSD symptoms after a car accident. And she also had a treatment for generalized anxiety disorder. We used EMDR. Even one session of EMDR was enough for this patient to have a significant improvement regarding the symptoms. But we also found out that the patient had twins 10 years ago. This was a C-section, C-section, and they were delivered preterm, and they were taken into NICU, and one of them died. Only one of them survived. And of course, she has a lot of intrusive memories, and she suffered from a lot of, feelings of desperation, and her mother-in-law blamed her a lot, stating that she was an insufficient and bad mother. We worked with her with EMDR, and we saw that her anxiety symptoms decreased significantly. This was the first case I had in this area, and she said that for the first time in 10 years, I'm not fighting with my daughter, she said to me. I used to fight with her all the time, but now we are on better terms with her. So this was her feedback after the EMDR session. Another case, she came to us with her husband. They wanted to have a couples therapy because they were on the verge of a divorce. They weren't getting along well at all. And they were fighting all the time. They had an uncontrolled rage towards one another. That's what they said to us. And her back depression score was 36. Her husband had 24 points. And their problems started after the delivery of their second child. The woman had insomnia, restlessness, lack of energy, loss of libido, and she had a lot of anxiety. She didn't expect anything from life, and she was suffering from anhedonia, and she was always afraid of losing her baby. So she used to wake up and looking at her child, whether he was breathing or not. And she could not control her rage, and she said that she was starting to beat her elder child. When we looked into it, we saw that she had a lot of complications during delivery. She had spinal anesthesia during delivery for C-section, but her blood pressure increased significantly. The anesthesia didn't work. She was afraid that she was going to get paralyzed. So when the baby was 4 months old, she started to vomit, and she was diagnosed with reflux, and the doctor said she had to go under surgery, and they said, feed her often, but feed her with small amounts of food. So that's why she started to wake up at night and check on her baby. And one night she woke up and she found out that the baby was about to, lose consciousness because lack of breath. Her back depression point was 36, and we also have an impact event scale, IES. Her score was 75. And one trial states that if you score above 35, then this could even disrupt your immune system, and she scored 75. So they started couples therapy with us. I told her that, using couples therapy on you is like, giving someone an advanced driving technique without that person having a driver's license. So we need to work on more fundamental stuff. So we started to work on her problems during delivery and the health problems of her baby. And we used EMDR on this patient. Right after the first session, she became more, at ease. She came to me and said that she was feeling much more comfortable, and we continued with EMDR. On the third session, the symptoms of PTSD and depression decreased considerably. We continued to work with this patient, and we understood that the loss of her mother and her rage against her boss created traumas for her. But now she had a different approach, a different mentality, and as you can see, her back depression score went down to 9, and her anxiety score went down to 10.
2,5 dakika.
Do I have 2 minutes? Oh, I'll go on longer than 2 minutes. I'm sorry. This is my last case. This woman came to us with high anxiety, feelings of insufficiency, desperation. She had 4 pregnancies. She also had rage, and she had 4 miscarriages. And she had a lot of anxiety because of trying to remember all these sad memories. She wanted to be a mother, but she was afraid of having another miscarriage. And it created a lot of anxiety for her to remember all those miscarriages. And she also had a lot of rage towards women who had children.
Terapide ne yap?
As for the therapy, this is what we did. We talked about the memories regarding the miscarriages and terminations of pregnancy, and we also talked about her relations with her peers that fell pregnant. And when the treatment was underway, the patient became pregnant, and for the first time during the pregnancy, she did not suffer from anxieties. And the second month and the third month went also quite well, and in January she gave birth to this baby who is called Angel in Turkish, Melek. So in the prevalence studies, now let me go back to the prevalence studies. We work with scales. We don't do face-to-face clinical trials. And of course, prospective trials are limited in number. We need more prospective studies. And in these studies, the scales that are used are general trauma scales, and they do not necessarily measure delivery or birth-related traumas. And we use the modified perinatal trauma post-traumatic stress disorder survey, and we are translating this into Turkish as well, and hopefully come next year I will be able to share Turkish results with you. So we need more studies, more trials in this area. This is my final message, and I also would like to share this with you. This girl was a preterm baby. She was in the incubator for 1 month, and after she was discharged, she experienced pulmonary complications, and the mother developed preeclampsia and also coagulation problems, and she came really close to death. The mother was traumatized, the father was traumatized as well, but now all is well. And this is my daughter, by the way. That's why I wanted to share this story with you. So sometimes things do get better. That's why I wanted to share this with you. Thank you.